Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
In order to understand and talk about restorative dentistry, a certain nomenclature is used. First, we'd like to review the surfaces of the teeth. We will use a maxillary first molar to do this. As we look at the surface of the teeth, the mesial surface is referred to as surface number 1, the distal surface as surface number 2, the buccal surface as surface number 3, and the lingual surface as surface number 4. The occlusal surface is referred to as surface number 5, except on certain teeth that have a transverse ridge when we divide the surface, with the mesial half of the surface being referred to as surface 5 and the distal part being referred to as surface 6. As we identify classification of cavities, we use this nomenclature to indicate the surfaces of teeth that are involved. A class 1 cavity can be identified as the occlusal surface of any tooth or the occlusal two-thirds of the buccal or lingual surface. We have two examples of this. This would be a class 1 cavity on a molar. The cavity has been prepared for a gold inlay. This would also be considered a class 1 cavity, and it has been prepared for an amalgam filling. Class 1 cavities can have extensions over the lingual or the buccal. If it goes to the mesial or the distal, we then refer to it as a class 2 cavity. Here are two examples of class 2 cavity preparations. This tooth has been prepared for a class 2 gold inlay restoration. The walls are tapered, since the restoration would first be done in wax, then removed from the tooth or the die model and made into gold. This particular one has been done to be restored with amalgam or silver alloy. Since this is a plastic material, instead of being tapered, it is undercut. From the time you begin to place the plastic material, silver amalgam, you have 3 minutes roughly to pack it and carve it back to the normal anatomy. Also, an example on this tooth is the surface 6, which is a class 1 with a lingual extension. If this involved the other surface, it would then be called a class 2 with a lingual extension. The class 3 cavity preparation is defined as that on the interproximal or the joining portion of the anterior teeth, which would include from the distal of one canine to the distal of another. We have here an example of two types of prepared cavities. This one prepared for a gold inlay, this one prepared for a plastic filling material. Both are class 3 cavity preparations. A class 4 cavity preparation is similar to the class 3, except that it does involve the incisal edge. It is similar then to a class 2 really, since it is a two-surface restoration involving either the mesial or the distal and the incisal. The class 5 cavity preparation is defined as that preparation in the cervical or gingival 1/3 of the tooth. We have again examples of two different types of prepared cavities. One which has been prepared for a gold inlay, another which has been prepared for a cohesive gold restoration. Both are class 5s. Even though the outline form is different, they do involve the gingival 1/3 of the tooth. We refer to this always as a class 5 prepared cavity. These are examples of class 6. There's several ways of determining a class 6 restoration, but basically it involves the mesial, the distal, and the occlusal. However, if a cusp is replaced, it may then be referred to as a Class 6 protective cusp restoration. In the new terminology that has been accepted by certain regions of the country, they also refer to this as a Class 2 restoration. In other words, it involves the occlusal and the mesial or distal, or the mesial and distal. And on certain state board examinations, these are referred to as Class 2 restorations. When a cusp is involved, whether it's a Class 6, a Class 2, it is referred to as a protective cusp. Once we go beyond the Class 6 protective cusp, we then go to the next classification of prepared cavity, and we refer to this as R, or restoration. We have before us two examples of restorations, or teeth that have been prepared for restorations. One is the full gold crown, or the tooth that has been completely prepared, and the tooth material will be restored with a full gold crown. The other one is a 3/4 crown in which the buccal, or perhaps it could even be the lingual surface, is not restored, but the rest of the tooth then would be restored. We have one more example of a tooth which has been prepared for a full coverage restoration. This tooth has been prepared for an aesthetic restoration, which may be made of porcelain or a combination of porcelain and gold. This particular one is an example of a porcelain jacket crown. We will now show you some of the examples of the various classes of cavity preparations that have been restored with different types of materials. This is an example of a tooth that has been restored with 3 Class 1 cohesive gold restorations. And you'll notice that the anatomy has been reproduced right in the restoration. You'll be able to see the grooves and how they build up on the cuspal inclines. This is an example of a tooth that has been restored with 2 Class 2 amalgam restorations. The one on the mesial, you will notice, has a marginal ridge built with the same contour as the normal anatomy of the tooth. And then we have the cuspal inclines and the central fossa built right into the restoration. The distal is a Class 2 that has a lingual extension. Now, when you remember, when you replace this material or place this material into the tooth, you have about 3 minutes from the time you begin to pack the amalgam until you've developed the final anatomy. Then after a day it can be polished. This is an example of a tooth, a lower bicuspid, that has been restored with a Class 2 inlay. Notice how the anatomy, the contour, the marginal ridge, and the contours of the tooth are built right into the gold inlay. This is an example of Class 3 cavities. These are restorations that have been previously placed and then failed or washed out after a time. The material in these now is a silicate material which will dissolve in the oral fluids. The next slide shows the teeth after they have been restored with one of the newer plastic materials called composite. This is a technique example of a Class 4 restoration. The material used to restore this tooth has been cohesive gold. However, if it were restored with a cast gold restoration, it would appear much the same. It replaces the distal contour, the marginal ridge, and the incisional angle of the tooth. This is an example of a Class 5 restoration. Remember, the Class 5 restoration involves the cervical or gingival 1/3 of the tooth. This happens to be a tooth that has been restored again with cohesive gold. However, it could be restored with a porcelain inlay, with an amalgam filling, or a gold inlay. These are examples of Class 6 restorations. The restorations are done with silver amalgam. Notice the contour of the marginal ridges, the contour of the tooth, the reproduction of the anatomy, and the cuspal inclines. This is a 3/4 crown on an anterior tooth. Notice that it replaces the lost tooth structure with gold back to the normal physiologic anatomy of the tooth. These are examples of posterior teeth that have been restored. One has been restored with a 3/4 crown. Notice the roll of the marginal ridges, the contour of the tooth, the definition of the dental anatomy and the cuspal inclines. And also notice that the one tooth has attached to it a ponic and is part of a bridge. So it serves as an abutment for a bridge, a replacement of an artificial tooth. but notice the reproduction of the anatomy to the normal physiologic anatomy of the tooth. This is the same type restoration. This is a full crown which has been done in porcelain. Again, notice the natural appearance of the tooth, the contour of the tooth, the roll of the marginal ridges, and notice particularly the contact area, how the teeth contact with the tooth next to it. Notice also the detail of the grooves and the various cusps, the replacement of the various cusps in their natural position. This is the same thing that has been done in gold. And we should notice again the detail of the anatomy, the roll of the marginal ridges, the contact area with the adjacent restoration, and the buccolingual contours of the tooth. This is an example of a person who as a young child had some type of disease or illness that interfered with the maturing of the enamel of the teeth. And she suffers with a condition called hypoplastic enamel. This can be restored with porcelain or a combination of porcelain and gold. The next slide shows the restorations after the teeth have been prepared and the restorations have been made. We have 4 porcelain jackets and 2 porcelain and gold restorations. The next slide shows the restorations in place and shows the difference in appearance. The natural appearance, notice the contacts, the natural appearing teeth, they resemble very closely natural teeth. This is an example of a bridge that has not been placed in the mouth yet. A bridge, as you know, is a combination of an artificial tooth or a ponic, which is the middle part of this restoration, and then the abutments, those that are attached to the natural teeth, as either full crowns or 3/4 crowns, and then support the ponic. Notice again the natural appearance of the anatomy, the roll of the marginal ridges, and the contours which permit for the stimulation of the soft tissues and the self-cleansing effect and the ability for the patient to clean all around the bridge. Now, in order to point out some other things, we would like to show you a dental x-ray or a dental radiograph. And you have before you now one of a pair of posterior bite wing radiographs. The purpose of the posterior bite wing radiograph is to identify certain areas, such as the bone, the hazy part that you see around the roots of the teeth is the bone. The dark space in between the teeth is the interproximal space, and normally this was filled with soft tissue which would show up as dark on the radiograph. The little dark line in the middle of the tooth is the pulp and the pulp chamber. Then the gray area is the dentin portion, and then the white area in here is the enamel portion. The very opaque white spots are restorations. And I want to call special attention to the restorations and point out several things. If we look at the restoration on the maxillary first molar, we'll notice that the restoration does follow the contour of the tooth. If we take and look at the mandibular first molar, we'll notice the restoration does not follow the contour of the tooth. It has no curvature and it has an extension which is referred to as an overhang. This creates a problem of soft tissue and eventually bone loss. It may permit food impaction and irritation of the tissue. So this is not correct. This is more correct. This is not correct. Now, another thing we'd like to call to your attention is the fact there is a definite relationship of the pulp chambers to the restorations. And when you're preparing the cavities in the teeth, we have to be very careful that we don't become too radical and come either too close to the pulp chamber or actually expose the pulp chamber. As people increase in age, why the pulp chambers become smaller, so we know that this patient is not a very young patient because the pulp chamber has receded somewhat. Also, in those teeth that have large restorations, we'll notice that the pulp chamber is smaller. Nearly anything you do to the tooth will cause the pulp chamber to become smaller because it's a protective mechanism. As there's any trauma, whether it's disease, restoration, heavy force, why the pulp chamber has a tendency to lay down more dentin core and protect itself. And another thing we can see from the posterior bite wing that I think is important is the relationship of contact between the teeth. And this is an important relationship because if we don't maintain the contact, we'll get food impaction between our teeth, then we cause gingival irritation that can lead on to various types of soft tissue disease. These things are very important when you create dental anatomy, when you create contour, that you replace the contact in its normal physiologic position which, as you know, is just slightly below the outer roll of the marginal ridge.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.